Chole Sakana with Pikuach Nefesh on Shabbat. Now there's an interesting case to bring down the halacha. Yom Tov samuch leShabbat. If Yom Tov immediately precedes Shabbat, do we make such calculations and perhaps try to break Shabbat to get the treatment needed for the chole on Yom Tov to not have to break? Do we try to break Yom Tov and not have to break Shabbat? Are there such calculations or not? The Rav Ovadia writes very interestingly. He explains that Yom Tov shechal be'erev Shabbat u'lefanenu chole shekayet she'en bo sakana. Right now it's Yom Tov on Friday, and the chole is not yet at the status of sheyesh bo sakana. It's still she'en bo sakana. Ach harofim omrim she'im lo yikabel arta b'yom Yom Tov tipul refu'i sheyesh bo isur Torah v'Shabbat yichabed alav choliyav v'yavo lidei sakana. But the doctors are saying that this person is inevitably going to get worse and will eventually need this treatment, will eventually need to go to the hospital and get help for an infection or whatever it may be. Now, Halacha explains, if we know that for sure he is going to get worse, his condition will deteriorate on Shabbat, and it will become a chole shesh bo sakana. Mutav la'aktim v'chalel et Yom Tov, shehu isur lav, ma sheyitzarchu lechel Shabbat shebesekila. It's preferred to violate Yom Tov, which is a lesser degree of an avon, than to wait for Shabbat and then treat him then. So this includes, let's say someone isn't feeling well, and they're going to progress into an infection, and it's clear that they have a UTI, for example, and then at her age, it's dangerous. Halakha says that on Yom Tov, when it's still not yet at its highest degree, you should still take him to the hospital, get treated earlier. That way you don't need to go break Shabbat to get the same treatment as well. Now Halakha continues and says, interestingly, but if it's not certain, we don't know which way she's going to turn, if it's going to turn for the worse or for the better, don't break Yom Tov assuming she'll get worse if you don't know for sure. Rather, wait to see what the course of life takes, see whatever Hashem decides, and then if she does become shesh bo sakana, chole shesh bo sakana on Shabbat, then you treat her as normal, like we discussed. You break Shabbat to get her the help she needed. And quickly, refuah shesafek im to'il. There's another category of halachot that medications that we don't know if it'll necessarily work or not. We're not talking about medications that aren't approved by modern science. We're saying these medications help. We know they treat them and they use them to help conditions. Generally, even though we don't know now if this medicine will help them. Let's say someone has developed, unfortunately, their body does, antibiotics don't work for them. They need to work on different strands or different types of medications because they've been exposed to so many types of antibiotics that not all standard ones work. The halacha still says, we still break Shabbat and give them this medication that generally works. The principle is that anything that has a doubt that can save or help someone who's in a Pikuach Nefesh situation, we do on Shabbat to get them the treatment. We don't need to be certain that it'll work. Even if it could potentially help, we use that medication as well, medication that's proven, not medication that isn't proven. Inshallah, have a wonderful day and Chazak Baruch.